COVID-19 was declared by the WHO as a worldwide pandemic on 11 March 2020. The COVID-19 is caused by a pathogen called the SARS-CoV-2, which was recently confirmed to be a global health problem as it affects humans and also animals. This alarming pandemic has now been reported in 215 countries, with 257 million confirmed cases and 5 million deaths worldwide as of 22nd November 2021. In Malaysia, there are 2.6 million confirmed COVID-19 cases and 29,000 COVID-19 deaths. The first 2 COVID-19 cases in domestic animals were recorded in a Pomeranian dog and a cat in Hong Kong. Ferrets are also highly susceptible to COVID-19 and can transfer the virus to other 9 ferrets through direct contact and air. In wild animals, tigers and lions were prone to COVID-19, such as 2 Malayan tigers, 3 Amur tigers, and 3 African lions were tested positive in Bronx Zoo, New York City. Furthermore, minks are also very susceptible to COVID-19, which led to 17 million minks being caught to curb the virus spread to humans in Denmark. According to the research, other animals that are susceptible to COVID-19 include cats, dogs, golden Syrian hamster, snakes, and turtles.
Since most of the pet owners we interviewed are not fully aware of their pets that can be susceptible to COVID-19 infection, we had the opportunity to interview Associate Professor Datuk Dr. Velayan Anak Lelaki Subramaniam, a pharmacology lecturer from the Faculty of Pharmacy, University Technology Mara, UiTM Pucha Alam, who has 35 years of experience in zoo, wildlife, and exotic animal medicine and surgery. Secondly, Dr. Nur Indah Ahmad, a veterinary public health lecturer from the Faculty of Veterinary Medicine, University Putra Malaysia, UPM. She is specialized in veterinary public health and zoonotic diseases of pets. Thirdly, Dr. Farina Mustafa Kamal, a veterinary immunology and virology lecturer from the Faculty of Veterinary Medicine, University Putra Malaysia, UPM. She is specialized in veterinary immunology, especially virology.
What is the overview of COVID-19 transmission in animals, particularly in Malaysia?
They have detected about 5% pet cat has got COVID. It's from the patients which were positive, where they were handling. So there are some people, they sleep with their cats, they huddle their cats, they have spread it. So normally it's a routine that when you're a medical person involved in the COVID ward, when you go back, you have to take baths before you could go to your pets or even to your children. So that is number 1. So that is, and coming to zoos, animal, because there are the keepers. We call them the keepers. The keepers work very closely to the animal. See, zoo animals are something that they are very close contact. They feed the food. Sometimes they have a cage where they can restrain them. Then they can, have contact, not like contact like human. But when they're cleaning, when the animals are put, they undergo stress. So far in Malaysia, no zoo animals has been affected.
As the pulmonary system of domestic animals and mammals are almost similar to humans, that the SARS-CoV-2 virus only has virulence in them.
Okay, so in terms of animals, in the OIE website, which stands for Office of International Epizootic. So it is basically equivalent to WHO for human. Basically, they have list of susceptible animals towards SARS-CoV-2 infection. Similarity with humans will be non-human primates, okay, like macaques. Okay, for companion animals, cats have higher susceptibility compared to dogs. So these are mainly because of the amino acid sequence at the receptor level, okay, of the ACE2, which has similarities with the one in humans.
So what will happen to the animals, specifically pets that are infected with the virus, and what are the laboratory investigations used to diagnose the disease?
I'm talking in general. If any animals are suspected of having SARS-CoV-2 symptoms, okay, probably mostly due to the owner themselves, okay, that were tested positive for COVID-19. Usually, the lab diagnostic assays will be the same like human, QRT-PCR, which test for the viral antigen. For the one that you mentioned about the study in Canada, you mentioned it was serological study. So basically, they were detecting antibodies. So most of the time for antibodies, they will be using ELISA. But again, these were past infections. Okay, so probably the animals have cleared off the symptoms if they are symptomatic. So those symptoms that are often reported in companion animals usually are respiratory symptoms, which is sneezing, coughing, and then they also have symptoms related to gastrointestinal tract, such as diarrhea or vomiting, and in general, some of them came down with fever as well.
What are the management in pets who are positive with COVID-19?
In general, according to CDC and AVMA, which is the guideline from the American Veterinary Medical Association, so they have come up with a general guideline for pets. So just as how we treat a family member, our brothers or sisters, our children, for example, who are positive for COVID-19, the same applies. First of all, you would want to quarantine the pets in a room, in a confined space whereby it still can move, can express its normal behavior, but you would want to limit as much as possible your close contact with the pets. Of course, you would need to monitor, and it would be a good idea to call up your usual vets that you go to, and then they will help to monitor the animal in general. So otherwise, it's always like the usual preventive measures and personal hygiene that we apply to other family members.
As there are multiple COVID-19 cases recorded throughout the world, we decided to interview some pet owners regarding their awareness of the COVID-19 transmission to animals. Are the pets vaccinated? If so, what vaccine?
We rarely take her to the vet. We only take her to the vet when she's like hurt. For example, if her leg suddenly got a wound, something like that. And then for the vaccine, I'm actually not quite sure because I think my father had bring her a few times, but I'm not quite sure what kind of vaccine.
Do you know how to take care of the pets during COVID-19? If so, how?
So, during this COVID-19, we do have some extra guard for our cats by keeping them in our house area. It is to prevent them from having a close contact or interaction with random people, such as people that passing by or jogging near our house. It is because we never know where is the virus as we can't see it, so an early prevention is better.
If you are noticing any changes in your pets, such as fever or cough or flu, what is your action?
I will immediately take them to vet, and then the doctor will provide us medicine like antibiotics or any kind of medicine.
At the end of this documentary, we hope that the viewers, especially the pet owners, would gain awareness of the vulnerability of the pet are encouraged to take care of their pets responsibly to prevent undesirable transmission of the disease to animals.